Before I start talking about the research that we're doing, I thought I would give you a little bit of a perspective on our aphasia groups. This coming year, so next year, is going to be 20 years since we started aphasia groups at the University of South Carolina. And I started them in our clinic. And it was because I came from the University of Arizona, where I did my doctoral training. And we had aphasia groups there that on regular basis had somewhere between 80 and 90 people. And we would have aphasia groups every Friday. So it was a large community of people that got support, maybe not so much from us, but from each other. So people with aphasia were able to come and share their stories, and also spouses were able to, and you know, some people came with their children, or they were parents. So people were able to share stories about how they had tackled different problems associated with having aphasia, living with it, and or living with somebody who has aphasia. So when I came here to the University of South Carolina, I saw that this was greatly lacking here. There were no support groups for stroke survivors, or more specifically, people with aphasia. So we started our first aphasia groups in a speech and hearing center that we moved away from probably 10 years ago. We initially had 3 members, and I was just checking around to see if any of those were here today. I don't see any of them. That was Willie Bonaparte, Donald Van Koevering, and Babcock Fitch. Now, I don't see any of them here, but I suspect that at least a couple of them come still to aphasia group. Is that right, Lindsay?
Yes, that's correct.
Yeah. So that was a long time ago. So over the years, our aphasia groups have grown by leaps and bounds, and we've tried to get the word out as much as possible among people with aphasia, to just tell people that this is something that's available to the community.
The support of the chair needs to come over.
That was in 2002 that we started this, and I was just trying to put that in perspective, how long ago that was. I was thinking about Lindsay was probably not even, I don't know if you were in elementary school yet, Lindsay. But that was a long time ago. So we've come a long way from having very small aphasia groups to now having people who are maybe toddlers or just a little bit beyond that, who are now actually helping us out with these groups, and that's our students. The research that we do in aphasia has also grown a lot. We started with very small studies, usually with somewhere between 3 and 5 people, to studies now that include sometimes even as many as 100 individuals with aphasia. And the main thing that we're trying to figure out is how we can improve the therapy for aphasia for people to get better long-term outcome. Most of this research has been in folks with chronic aphasia. And I'm going to talk a little bit about our findings as we go on. We've also expanded to do research with people who just had a stroke and are in the hospital or in the early phases of recovery. So we really cover now everything from the initial time that somebody has a stroke and has aphasia, to including people who are many years post-stroke, to look at what can be done to improve outcome in the long run. So we are just about to finish our largest treatment study that we've already done. So that's called the POLAR study. And many of you who are here today, and many others, actually participated in the POLAR study. That study involved coming to the University of South Carolina for 3 weeks at a time and getting individual sessions focused on improving your ability to speak. So either focusing on the sounds of speech or focusing on the meaning of speech and language. So 3 weeks, and then people would take a 4-week break, and then they would come again for another 3 weeks of therapy. And for those of you who've gone through this, I appreciate all the work that you put in. I hope that it benefited you, but if it didn't, I can assure you it will benefit the larger community of people who are stroke survivors and are dealing with aphasia. Also, I want to thank you because I know that many of you went through a lot of different MRI sessions, which I know are never very popular, but are an essential part of what we do. Because that allows us to understand how is the brain healing itself. If you think about recovery from aphasia, that's really how recovery occurs. The brain has to go through certain processes that promote growth and improve the long-term outcome after the aphasia has started. So what have we figured out so far as a result of this large study in aphasia? First and foremost, which is the most important thing, is that people with chronic aphasia, people who are months, years, and many years post-stroke can still improve. Now, I understand that a lot of times that improvement can be very incremental, but if you look across years, many people see very substantial improvements in their ability to speak, for example. It was thought for the longest time that once you were past sort of the 6 months, maybe even out to 12 months after the initial stroke, that was it. You were never going to get better. Fortunately, through research like the kind that we're doing, we now know that recovery months and many years after stroke is very much possible. Now, we did a study a couple of years ago looking at our longitudinal data because many of you maybe came here 2005, 2008, and now are still coming back for more studies, and we're able to look at how has somebody progressed, let's say 10 to 12 years ago to how they are today. So we're able to chart what is that improvement, or if somebody hasn't improved, if they're stable or not, we're able to look at what are the factors that promote improvement. The most important factor, and I don't know if you guys have heard about this research, anybody care to guess what is the most important thing for people to do to keep on improving? Anybody want to give it a shot?
Just get busy and try it.
Okay.
My child sounds like he's saying to practice speaking as much as you can, right, Mike?
Yeah.
Absolutely.
Yes, me too.
Yeah. So what we found, the most important factor was exactly that. So how much speech therapy somebody was able to get. And I bet you that speech therapy is very much associated with just how much you try to talk, how much you try to engage. So we found that in the long run, people who got more aphasia therapy tended to show more improvements than those who didn't.
Right.
So that's looking across many years. Now, again, I think that that could also be equated with just trying to work on your speech and language by yourself. The worst thing probably is just to sit in front of the TV and do nothing. So what else did we find? In a more recent study that we're about to publish, that is led by Laura Lee Phillip, who's been, I'm sure many of you have met. She's been in our lab for a while, showing that age and the severity of the aphasia are actually related to long-term outcome. Now, I will say that even though those two factors are related to outcome, they actually account for very little in trying to predict who gets better. What we really find is that age doesn't matter that much. So even if you're at the older end of the spectrum, you can still expect to show improvements with therapy. The other thing that we looked at, which was the aphasia severity. So many different studies have shown that people with very severe aphasia tend not to improve. And what our research shows is that, yeah, that's true, but the effect of that is very minimal, which means that if you do have very severe aphasia, you still can
I don't think
improve
yours is
quite a
severe.
bit. For those of you who completed the polar treatment study, what you will remember is that you did two types of therapy. And again, I talked about this earlier. One was focusing sort of on the speech sounds, and the other one was focused on the meaning of language. And what we found with the polar study is that it really matters what kind of therapy you get. It isn't just that any therapy is just as good. The kind of therapy that people receive actually matters. And what we found was that people with a milder aphasia benefited more from working on things like word meaning, words with ambiguous meanings, words that are similar, but might mean the same thing or might mean different things. So that was for the people with milder aphasia. For people with the more severe form of aphasia, what we found was that they benefited more from therapy that focuses on the actual speech sounds. So not so much on the meaning, but literally on focusing on producing the sounds of speech and what we call phonology and motor speech. So it's really focusing on, not so much on the meaning, but rather on the speech sounds themselves. And this is something that we didn't know before. And this is very important, maybe not for each individual, but for the speech language pathologists who treat aphasia. This is very important information to have. Because you can imagine if somebody is going for aphasia therapy today, their clinician wants to know what is the best thing for a given person. Does that make sense? So what this helps us do is to better tailor treatment to each individual based on what are their strengths and what are their weaknesses. What else did we find? So treatment type really matters. In a more recent study, so Lisa Johnson has been working on a project that I think is very important to talk about. But if we look at the severity of aphasia, so if we took everybody in this group today who has aphasia, what you will find out is that no one's problem is exactly like somebody else's. So there's a large variability in the problems that might be associated with aphasia. Some people have more severe aphasia than others. Some people have greater difficulty speaking, difficulty understanding, and some people may have different strengths. But what we find out is that the best predictor of these individual differences is really where the brain damage happened that caused the stroke. And many of you have sat down with me when you had your MRI scan, and I've shown you what that MRI scan looks like. And I've gone over how that relates to the kinds of difficulties that you might be experiencing. That thing that we see on the MRI scan is very closely related to the problems that you have. Okay? But now here's an important thing that we figured out with this study is that once you put that aside, once you've accounted for what can be explained by the brain damage that the person got as a result of the stroke, the other things that are very important are things like just overall health. Things like diabetes, for example. People with diabetes in the long run end up having more severe aphasia. But the good news with that is that if you exercise, it actually gets rid of some of the problems that you have with diabetes. So the main things that we find there is that it's very important for stroke recovery, not just to work on your speaking, but it's also important to do things like physical exercise. So then I'm talking mainly about, anything that gets your heart rate up. So maybe not everybody can go out and walk, but if you can, try to get as much walking in as you can and try to do it as briskly as you can as possible. If walking is difficult, maybe try some other types of physical exercise. but it seems to be the case that, and this is not just for stroke, it's for many other things, but that physical exercise for long-term recovery is very important. And that's for our next study, which is our previous study was called Polar. The next study is called Terra. And that the purpose of that study is to compare online therapy or therapy like through the modality that you're watching me at right now to in-person therapy. So if you do get enrolled in that study, you would be randomized to either having to come here to the university, getting therapy just like you did for Polar, or you would have to do therapy online. And what we ultimately want to say is that if you get therapy online, it's as effective as the therapy that you get in person. And when we started this, which was pre-COVID, Medicare and Medicaid and most HMOs did not pay for this kind of therapy. But now, since COVID started, they actually changed the laws about that quite a bit, because if they hadn't, nobody would have been getting therapy anymore. So what we're hoping to show in that study over the next 5 years, at the end of it, that you can get effective therapy with a clinician doing one-on-one online. So that's the overall purpose of it. Just like before, we are going to need a lot of participants. This will take 5 years to complete, and many of you, we are going to be in touch with you, and hopefully if you do qualify, that if you would kindly consider being included in the study. Unfortunately, you are going to have to get an MRI again, because we got to look at what's happening with the brain. But then it gives you another 6 weeks of therapy with a clinician one-on-one. And I'm biased, but I think we have some of the best speech language pathologists here in the country in our lab. Also, we are starting a study in collaboration with Dr. Archie Hillis at Johns Hopkins University. That's for people who just had a stroke. So not like a group like yourselves who maybe had a stroke a while ago, but rather like somebody who had just had a stroke, let's say this week. We're trying to look at whether certain medications can actually enhance the long-term recovery from stroke. So that's going to be a separate project that we're going to be heading up. So this drug treatment for aphasia. So a lot of new research is going to be happening. In addition to what I've just told you about, we always have also other studies ongoing in the lab. And, you know, I hope that you consider at least participating in some of those studies. I always tell anybody who comes to our program, even if the therapy or whatever you're doing doesn't benefit you directly, it does contribute to the overall knowledge that we have about aphasia. So it may not, you know, hopefully the therapy, for example, that you get with us is beneficial and it helps you improve. But even if it doesn't, it helps us understand why wasn't it effective and what else could we do to make it more effective in the future. Because believe it or not, in North America right now, there are 2 million people with aphasia. It's a very large community. And what we are trying to do is to benefit every individual who participates in our research, but not just that. We are trying to benefit this really large group of people so that we can publish our research, we can get it to the clinicians who are actually treating the individuals, so that it can have a much broader effect, so that the next person that is going through what you have been going through will also benefit. On that note, we are very much trying to increase our efforts to get the word out among the clinicians who treat aphasia about our research, what it's showing, so that we can actually make a difference within this broader community of 2 million people with aphasia. I think that really gives a sort of an overview of the large projects that we've had ongoing and also where we are going. I'm not going to talk about all the other smaller projects that we have going on, but there's a lot of other things that we're trying to do to better understand what is the nature of aphasia, what is the nature of aphasia recovery, and how can we best benefit each individual so that in the long run, we can maximize their recovery and hopefully improve their quality of life.